Thanks for giving of your time this evening. Hopefully we can get through a topic that can feel a little overwhelming with some practical tips and tricks. My name is Desiree White. I am a family nurse practitioner and I'm the program director at the Foster Adoption Clinic Center of Excellence in Tacoma. I'm not able to see the chat or the names that are in the group right now. So hopefully there are some names and faces that have made their way down to Tacoma before. If not, I hope to meet you in the future. I am an adoptive mom, and I have been my primary practice has been in childhood trauma for 25 years, and at-risk families. So this is a topic that I get to walk through not only personally with kids that have been in my home, but also with families that have come into the clinic. So we will do our best to be able to, again, tackle a big topic and make sure that you do write your questions in the chat so we can address those at the end. So the goal today is we're going to be going over baseline attachment formation and disorders. We are going to go over the 5 Fs, risks of overly friendly kiddos, the most practical part, tips and tricks on how to parent kiddos that just love to give loves, some takeaways, and for those that just are not going to be able to sleep tonight unless you have something to look up, we'll have some resources and references for you to be able to spend, your precious free time researching things. So, attachment. What is the absolute basis of attachment? For those of us that have ever held an infant, a newborn, we know when they cry, we respond. Something is wrong, right? So we have this internal dysregulation. A child has told us there is something wrong on the inside. And the thing that we do as the safe and responsible adult is we become the external regulator. We pick up the child, we check to see if they're hungry. We check to see if they need to have their diaper changed. We check to see if they're tired. We check to see if there's something that's hurting them. And we immediately address that internal dysregulation by being the external regulator. The child now becomes internally regulated, meaning that their need has been met, that they have been fed, they have been changed, they have been snuggled, they're no longer in pain. And that child now learns, oh, I can be regulated. I can trust that someone nearby, a tall person, is going to come and meet my need. I want to be able to communicate that again. And thus the cycle continues. I cry, the person, adult responds. I'm hungry, somebody feeds me. I've messed my pants, somebody will change it. And as we continue to build that foundational attachment, we move from I can regulate myself and be able to use my words. I can be able to anticipate my dysregulation and anticipate that someone is going to help externally regulate me so I can then be internally regulated. So at the age of 2 or 3, we have a child that can say, Mommy, I want a cracker because I'm starting to get hungry. That full sentence may not be there, but that's what they're communicating. And we know, oh, I need to give Johnny or Susie something to eat because they're starting to get hungry. And then at 10 or 11, hey, Mom, can I have some pizza? We now have the same thing where I'm communicating. I'm about to be dysregulated. Somebody else can meet that need. And I know who I can go to have that need met. So foundational attachment really is trust. I need to trust that someone is going to meet my physical and emotional needs. A safe adult is going to meet my physical and emotional needs because we are created to be in consistent, safe relationship. By virtue of that umbilical cord that attached us to the person who made us, we are created to be in relationship with someone else. And when that gets broken, then we have problems and we have talks like we have tonight. So attachment theory is all based on a psychologist back in the day. His name is John Bowlby, and he noticed that we have all of these street youths, if you will, who were in juvenile detention or the equivalent of it, and they all had some sort of emotional dysregulation. So his theory was if we have all of these same groups, demographics of people who are having the same issue, did they have the same problem prior to becoming a criminal? And he really went through, oh my goodness, there was actually an attachment problem way back at the beginning. So the stages of attachment, what he theorized and what we base a vast majority of our attachment counseling based now is in four stages. The first one being pre-attachment, and this happens in those first fundamental months of life when we're still kind of a blob on Earth, birth to 3 months, and our bonds are forming equally between objects and people. So really, a breastfeeding infant or a bottle feeding infant cannot tell the difference between nipple and human, right? I know that I'm being sustained by this food source and somehow it is coming to me. I don't know how or when, but it is. It's one and the same to a child really under the age of 3 or 4 months old. From pre-attachment, we move to indiscriminate attachment, and that's for about 6 weeks to 7 months, 9 months. We really have this, oh, that's the same person. It's a human that's bringing me that nipple, that food source. And we're starting to recognize it's mom that brings me that food source. I would like to be next to her, please, because she's the one that feeds me. Or it's grandma or grandpa that always has the bottle, the temperature that I needed. I would like to be with them. So we're starting to have some preference towards humans, but not necessarily any awareness of anybody else who has that bottle, correct? As long as you have the food, I want to be with you. That moves into discriminate attachment. So now we're into that stranger danger stage that we can see with a lot of young kiddos. It's, I know who brings me that food. I know who's going to hear and respond to my cry, and I don't want anybody else meeting my need. Thank you very much. So lots of stranger danger and a lot of separation anxiety in that 9 month range. Sometimes we can see it go a little bit longer. But our goal is hopefully to get to a multiple safe attachment stage where we can drop a kiddo off at daycare or at grandma and grandpa's house for the weekend. And a child knows I have multiple safe people who are going to take care of me. And I can limit my anxiety when they're not around. That I'm going to be okay until mom or dad come back because I'm with grandma and grandpa. I'm going to be okay at daycare or in Sunday school because mom and dad always come back and I can trust that that happens. Excuse me. The problem then becomes if we aren't able to move through any one of these stages and we get stuck or a particular trauma happens at one of these stages. When we look at attachment styles, if we go to the top, we have a positive model of others, meaning we know that we can trust other people. We're going to have that external regulator. Somebody is going to meet my needs. If we have that in combination of, moving to the left, a positive model of myself, I can keep my anxiety low because I know somebody will meet my needs. Then we can sit nice and pretty in this upper left-hand corner of having secure attachment. I trust that somebody's going to meet my needs, and I trust that I can not be anxious while I'm waiting to have that need met. That's a beautiful spot to be in, and hopefully everybody in the room right now has that secure attachment style. The problem then becomes if we have a positive model of others, meaning I know somebody's going to meet my needs, moving to the right-hand side, and a negative model of myself, I don't know what to do. When my needs are not getting met, I'm very high anxiety. I can't wait for that person to come to me to meet my need. We form a very anxious style of attachment. Moving down to the bottom left, if we have a very positive model of ourself, meaning I know I can wait, I'm okay, I'm going to be all right, my anxiety is going to be low, and a negative model of others, moving to the 6 o'clock position, meaning I don't know when my needs are going to be met, we move into a very self-reliant and avoidant attachment style. I can do it myself. I've had to learn how to do it by myself, and I don't need you to meet my needs. I'm not going to allow you to meet my needs. On the bottom right, we have a combination of those. So we have a negative model of self. I'm super high anxiety. I don't know what I'm going to do without someone meeting my needs. And a negative model of others, meaning I can't trust anybody to meet my needs. They haven't been there. They've let me down. Something has gone wrong. And we sit in that fearful attachment style, which ultimately leads to the overly friendly child. The attachment styles, this is a different way to look at it. If we look over into the far right, the characteristics of each one of these styles, if we have that secure attachment style, hopefully that's what all of us have, we're very comfortable in relationships and with intimacy, whether it's physical, emotional, or otherwise, and we're self-confident. We know, again, who we are, how we can handle ourselves, and what our expectations are of other people. It's a good place to be in. Avoidant is we're going to have, again, that very self-sufficient, I can do it myself, tends to avoid.
Oops.
Luann, are you there?
Uh-huh.
It looks like I got kicked out, so give me just a second to get us back where we need to be. If someone could let me know the last thing that you heard, that would be helpful. Does
You
this page look familiar?
you were on the attachment style side.
Okay. So the avoidant attachment style going to be very self-sufficient, tends to avoid emotional intimacy. I'm not going to let you get too close, and usually does not initiate or seek deep relationships because we cannot trust the other person to meet that need. Anxious or preoccupied. If you are like me, you're probably thinking about your neighbors or your coworkers, your spouse, your in-laws that maybe have one of these attachment styles. I'm thinking about a neighbor right now who can be real problematic. So our anxious style is going to really want to have somebody meet their needs, but is constantly worried about their own status within that relationship. I don't know what to do with my anxiety. I want you to meet my need, but I don't know what to do with my anxiety. And then our fearful attachment style really wants to be close to somebody, has a very hard time trusting others, and fears rejection and abandonment, again, because we have both the negative model of others and the negative model of self. This fearful side is where we find the five F's. Hopefully, this is not something that's new to you. We often talk about fight or flight in our kids as a trauma response, but we also have the freeze F, meaning we're just absolutely frozen there's any kind of conflict. The flop, becoming totally unresponsive or fainting. We do have kiddos that will have pseudo seizures in the flop component. And let me just say that you can have one kid that has all of these trauma responses. You can have a child who has all of these trauma responses during one episode. So it's not uncommon. You can kind of surf through the fight, flight, freeze, flop, all of them at once in kind of successive order as they're trying to figure out how am I going to navigate this particular conflict, be it good or bad. The fawn or flirt is the other F that can go along with fawn, is someone who is constantly trying to avoid conflict and is offering themselves as a solution to that conflict. So our kiddos that are asking personal questions of way too many people, offering their own personal story to complete strangers, walking away without checking back. They just kind of wander off without ever thinking twice that there's an adult that's supposed to be taking care of me. Really shallow social connections. So you'll have people say, "Oh, Susie, she is just the most delightful thing I've ever met. She's absolutely just fantastic." When you and I both know Susie is just surfing around trying to find anybody that she can connect with right now to make sure that she stays safe. And a lot of attention-seeking behaviors, we tend to see this more with little girls as they kind of fall into that flirt component. If I can just keep somebody close to me and do whatever it takes to keep them close, then I'm going to stay safe. And that really is a trauma response for that child. So when we don't have our attachments met in that early infant stage, if we have not progressed through those attachment stages, if we have had a discordant component of which style of attachment we now have, then we end up with an attachment disorder. John Medina is a molecular biologist, excuse me, a biological neurologist at University of Washington, and he's written a book called The Baby Brain. And I love this phrase. He says that first cry that a baby has when they first pop out of the mama's tummy is that guttural scream of who is going to keep me safe now, right? So with this entire 9 months, hopefully that child has been safe, but that first scream as they come out is who's going to keep me safe. When we don't know who's going to keep me safe, we can kind of go two different routes in the attachment disorders. There is the reactive attachment disorder, RAD, and that's a child or even adult who can't attach to anybody. So there is an intentional, although it can be an unawareness of, but an intentional pushing away. I can't attach to anybody. I'm not going to let you bond with me. I'm going to push you away. And behaviors can kind of spiral out of control. Disinhibited social engagement disorder, that's a big way to say indiscriminate friendliness, is a child walking around with who can I attach to? Anybody. Can I attach to you? Kind of the Are You My Mother, if you've ever read that Dr. Seuss book. And that becomes indiscriminate friendliness. I am just looking for someone that I can attach to in a way that feels safe to me. This can be a real problem when it's exacerbated by personality. If you have an outgoing kid who just loves to be with people and there's no pathology behind it, or you have a kiddo that's super impulsive, there's ADHD that's really feeding into this kiddo that's totally separate from trauma. This can really make indiscriminate friendliness a pain in the neck. This can be a really dangerous place to sit in. These are both diagnosable disorders. This is something that child psychologists and some family practice providers or pediatricians feel comfortable diagnosing. There's a very specific criteria that has to be met on both sides. At least in our clinic, we have ongoing conversations about reactive attachment disorder, indiscriminate friendliness. And a lot of times, if it looks like a duck, quacks like a duck, acts like a duck, it's probably RAD or indiscriminate friendliness. Treatment plans can continue without a formal diagnosis, but an ongoing awareness, I think, is important and probably something that you can talk to your own providers about, or at least initiate that conversation. The compounding factors for indiscriminate friendliness is the age and severity of the neglect and the abuse, when it happened, when in which area of that attachment stages of attachment you were sitting in when the abuse or the neglect started to happen, or it was at its most severe. The number of caregivers and placements when a child is in out-of-home care, or even the number of caregivers they had prior to out-of-home placement. If it was grandma and the neighbor and the cousin and the big sister that were all kind of taking care of the kiddo, and there was never an opportunity to attach, that can be a compounding component. The number of social workers, we know that there can be turnover that happens pretty significantly, and that's frustrating for everybody. GALs, attorneys, et cetera, anybody who's involved in an extensive case, the number of people that are involved or touch points with a particular child with this kind of trauma can be significant. School transitions and counseling changes. And let me just add here the attachment health of the adults. If we have, a real avoidant adult attachment style with a kiddo who is really fearful in their attachment style, and we're button heads, and this is a parent who can't attach to a child or bond to a child, and a child who is desperate to attach to somebody, and there's nobody there. So that can be a real problem, not only in the family of origin, but in out-of-home placements and foster placements or kinship placements. This is all assuming that a child has a baseline a neurotypical component of their life. If there's any kind of cognitive or intellectual cognitive disability, can be compounded. And then again, that inhibitory control with ADHD or other impulsivities, that's only going to make indiscriminate friendliness worse. And because there's no opportunity to laugh at something like this, I will just kind of bring up one of my favorite books, and that is the Are You My Mother book. Um, it's if you haven't read it, I would read it on your own and not to one of your children because that can be pretty traumatic. But I've always gotten a big kick out of the hen. I think I can only read this with sarcasm. Are you my mother? The baby bird asked the hen, and the hen, no, which I think is absolutely, absolutely hysterical. So, teens, this is the big pull your hair out. What in the world do I do with this teenager with indiscriminate friendliness who is on their daggam phone and is talking to everybody, sharing information on Snapchat, TikTok, fill in the blank social media, information that does not to be shared. What in the world do I do with this child? And I honestly, I wish I had the answer for you. This is a developmental stage where we are detaching from our caregivers. In a typical safe, trauma safe home, we are supposed to detach as adolescence and puberty hits. We are learning how to walk away and form our own tribe on our own. So that in combination with all of the trauma that may have happened in their home, and you add social media, it is a nightmare. And I honestly don't have a lot of great resources for you. In as much as you can, limit the phone use, really focus on real life connections as much as you can. And there are attachment-based counselors that focus directly on teens. There's actually some camp-based programs that I'm not entirely sure I'm a fan of, but at least we know that there are counselors that can focus specifically on attachment-based. So as you are looking for resources for your teen and getting your teen set up with mental health, behavioral health, if you just want to throw out there, gosh, we were looking for attachment-based counseling, that would probably be the best option for your teen. Because the statistics for our teenagers are not good. So studies show that anywhere from 50 to 90% of minor victims of sex trafficking had contact with CPS. So at some point they were in out-of-home care. We do know that the average age of sex trafficking for girls is only 12, which means average being between the ages 6 and 18 is when that young lady was exposed and trafficked. For boys, it's 14, so we're looking at 12, maybe 10 to 18 years old. We do know that it's a pretty high number of LGBTQ homeless youth that are trafficked compared to their heterosexual partners. And we look at probably close to 80% reported their trafficking started while they were in foster care. None of these are good numbers. Interesting, the studies do show that all of these young men and women that were rescued out of sex trafficking all reported having at least one safe adult to talk to, which tells me that we aren't asking the right questions and we don't know yet how to um, approach and keep our kiddos safe when they are most vulnerable. This is data right out of King County. This is pretty recent data, 2020. So if you are in King County, keep this in mind, but certainly this is going to be pretty representative of our state. So our young African American and Black um, young men and women are going to be at the highest risk, and females. So if you have a young, beautifully dark female in your home over the age of 6, she is going to be at pretty high risk of sex trafficking, especially if indiscriminate friendliness is a part of her trauma response. So that is, again, I don't have good data or good information when it comes to teens. It is pretty scary. So what can we do? Right? What is the thing that we can do? And the number one thing that you can do as a foster parent or as a caregiver is be that child's source. So if we go back to that attachment model, where can I trust someone to meet my needs? We need to make sure that you are that source, that you are the one providing the food, you are the one providing shelter, you are the one providing physical care, emotional support, and even bringing them to their medical appointments. I can't tell you how many foster parents I haven't met because it's courtesy workers or social workers or case managers that are bringing the kiddos in and not the foster parent. That is not against the foster parent. We all work. I want to be very clear that this list is practically very difficult. But when we have a kiddo that you know is really struggling with this particular trauma response, anything that you can do to make yourself, you being the source of their needs, is going to be important. That is going to mean shrinking your personal circle. So if you have a great community of people who are in your life, dropping things off, stopping by to say hi, play dates, you may need to shrink that circle. So it's just you and your immediate family that is a part of this child's life and is meeting their needs. I cringe a little bit, makes me sad when I have new foster parents say, "Oh, Johnny was dropped off on Friday evening and we went to a big family barbecue and he did great." Like, oh, that just makes me cringe. Johnny needs to settle, and Johnny needs to know that he's going to have a singular source to meet his needs and not be introduced to 150 people at a family reunion. Limiting or delaying caregivers as much as you can, if it's possible to not do daycare, that would be ideal. Again, I know that's not practical for a lot of families. If it's possible to stay home for the first week as this child is getting used to their new environment, that would be ideal. There's a lot of kiddos that arrive on Tuesday evening and they're in daycare by Thursday morning. And now we've got a whole new set of caregivers trying to meet needs, and that can be really confusing for a kiddo. Teaching adult deflection, this is probably the biggest skill and what's going to be the biggest help as far as making sure that your kiddo stays safe. Is really contacting the people in your community, in your circle, to be able to say, hey, Johnny or Susie is going to be joining us. She really struggles with knowing who her people are. If she comes to you, will you please refer her back to us? So you're at some sort of social event. Susie is surfing the room looking for anybody. If everybody's on the same page to be able to say, "Oh, Susie, let's go talk to Mama Jenny," and Mama Jenny will help get that for you. Or can we find Papa Steve and maybe he can get that for you? They would know how to do that. This is something that we work hard with in our clinic. Cute kids are cute, right? You want to be able to snuggle with them. That's our human response is to be able to touch and hold and provide. And if I know if I have a 4-year-old who comes at me as soon as I walk in the door with their arms open and trying to give hugs, I know to turn my shoulder and say, "Oh, show me who your new safe person is." So I can deflect and get that child back to who their primary caregiver is. That is, again, I think probably the biggest thing if you can teach anybody in your personal circle to really deflect back to you, that is going to be the most successful thing you can do because our goal is to really rebuild that foundation of trust. It is like a giant game of Jenga where you are pulling out the foundation, the very broken foundation of this child's life, replacing it with healthy components, and still building up as this child is developmentally walking through the world. So it can get really precarious. But that is ultimately the goal. So we want to put those trust attachments in. If at all possible, if you are a short-term placement, respite care, receiving care, whatever it is, those are all beautiful things. I am not against them in any way, shape, or form. But if it's possible to consider being a long-term placement for a child, so we know that they're not going to be bouncing around through placements while they're walking through their CPS journey, that would again be ideal for the child. And again, let me just emphasize, practically, I know that all of these are can be quite difficult. One of the resources that is available to us is FMLA and PFML. If you're not aware, the Federal Medical Leave Act is available for foster parents. I fill this out for foster parents pretty regularly, and I have been able to work with specific employers' HR departments to say, hey, we don't know how often this is going to be happening for this specific child, or if there's going to be multiple placements, can we have a blank FMLA available for intermittent leave? Is that possible? And some HRs have allowed that to happen, so we don't need to fill it out for every single child that comes through. Other HR departments feel it's necessary to have it available for every child, which is fine. I can fill it out for every child that comes through their door. Paid family medical leave is also available. And this is just for the state of Washington. But again, you can be paid if you are currently employed. You can be paid to stay home and take care of a child that may need to have you more than maybe another placement. These can run concurrently, they run separately. You're going to need to talk to your HR department on exactly how they want to work it. But please make good use for these. They are available to you as foster parents, and it is quite a great benefit. Tip number 2, teaching consent early, super, super early. This is something that we take very seriously in the clinic. We, from day one, we are asking permission before we touch anybody. Would it be okay if I took your blood pressure? Would it be okay if I listen to your back? Is it okay if I check your tummy muscles? We always ask before touching, and this has to start as early as infancy. Now, truly, an infant cannot give consent, right? But what we're doing is we're talking through, okay, we're going to lay down. Now we're going to change your diaper. Those are things that we can start to teach a child from the get-go, the process of things, the kinetic component of being safe. So when unsafe things happen, they're immediately aware that something has gone wrong. Adults really do have to model this, and I would encourage you to even model it with any bio children that you have in the home or children, forever children that you have in your home, to be able to just get in the habit of asking before you touch a child, even with a hug. And this is where sometimes generationally, grandparents, aunties, uncles, neighbors can get a little confused and sometimes a little offended with, what do you mean Johnny can't give me a hug or a kiss? I asked Susie to give me a hug. Well, Susie said no, and that's okay. Sometimes grandparents can have a hard time with that. So making sure that, again, your circle is aligned with the expectations of how to take care of our kiddos is important. Because what we can teach our children, and this is something that I'm sure many adults struggle with, is that no, thank you, because we're always polite when we're little, is a complete sentence. We don't have to explain to anybody why I don't want to be touched today, right? And this isn't about defiance. This is truly, I don't feel safe and I don't want to be touched, or no, thank you, I don't know you, I don't want to give you a hug. This is a complete sentence. And I think it's really important that everybody is just very comfortable with no, thank you, being, doesn't have to be explained. Emphasizing social boundaries. This is a big one. So planning ahead for crowds, right? If you're going to be going to a social event, going to the movies, going to church, going to even the clinic, being able to say, okay, here's who we're going to see. These are safe people. It is okay for the doctor or nurse to touch you. It is not okay for the front desk or the people in the elevator to touch you or to ask questions. It's not okay that we share that information with the person in the elevator. So if we can plan ahead and give kind of social stories to who are the safe people in our lives and make even a chart for a child to be able to say, you are in control of your story, your safe family, whoever that is. It may be that bio family is not safe right now, but if there are other members of the family that are safe, we can emphasize that. Your foster family is safe, your social worker is safe, to being able to kind of go out. And I've modeled this against a set of curriculum that's actually used for special ed classes in teaching personal boundaries. It's called the circles. You can Google this. And I love the way they are able to have what is acceptable in each one of these circles. So you have your private circle, you've got your hug circle, right? That's going to be your safe family, your foster family, your social worker maybe. Your far away hug circle, maybe that's even a bump or a handshake. Your wave circle, you can wave to the mailman. We see them all the time. You can wave to the lady at the library. That's good. And then the stranger circle. Nope, we're not going to talk to them. They don't get to ask questions. They don't get to touch. I think this is a great way to be able to teach kids what we can and can't do with who in our lives. Knowing the types of boundaries, I think, is really important. We tend to be really hyper aware of physical boundaries because physical abuse can be such a big component of the kids that come into our lives. That is important, but there's also the emotional component, the mental and the spiritual, right? So the emotional is, who are we sharing our feelings with? We're not going to emotion dump on anybody who walks by. And this tends to be an issue with our teens, right? I just want someone to connect with me emotionally, and we just kind of trauma dump on people. So being able to identify who are the safe people that we can do that with, that they're really intentional with being safe with you, I think is really important. The mental component, excuse me. Again, what are your thoughts and feelings? These are the things that are really sacred to you, and you are allowed to have them, right? Feelings are not bad. What we do with them is important, but they're not bad things to have. So again, having that boundary of who is safe to have those conversations with and who isn't. And the spiritual component, who is who are you letting take control of your life, right? Letting your callings and your talents in life are really important and special to you. And those are things that you get to develop on your own. And because there's no other real place to kind of mention this, I do want to say if you are struggling with or you get triggered by a kiddo who is maybe pushing a lot of boundaries, that physical boundaries, mental, emotional, spiritual, whatever it is, you're starting to get a little bit triggered by them, or you realize, oh, I've got trauma in that area that I didn't know about. Please make sure that you are seeking out the support that you need, that you're contacting a counselor, that you're contacting someone that you can kind of work through this. That's probably the healthiest modeling that you can do, is to be able to quietly take care of your own trauma while you are taking care of the kiddos in your home. Because we want kiddos to know that touch is good, right? We don't want kiddos to shirk every time someone comes near them. That touch can't is bad. It's automatically bad. That if they are shying away from anybody that comes near them because we've made them afraid to touch people or to have people touch them. Touch is good, and it's boundaries that helps keep touch healthy and safe, and that's really important. Hugs are great. Full front hugs, side hugs, there's different times and places for them, and we get to teach you how to do that as safe adults, and that is important. This graphic I put up here on purpose because I don't like it, right? I think a lot of times we think about boundaries as something as not to be crossed. And I think a better way to think about boundaries is what game are we playing, right? So if I take Marshawn Lynch and say, hey, I'm going out to play ball, and I call Ken Griffey Jr., hey, I'm going to play ball, and I call Andre Agassi, tennis player, hey, I'm going to go play ball, and I get all of them in the same patch of grass, they're all going to bring a different ball, right? They all think they're coming for a different game because I haven't defined the boundaries of that game, right? So I think that's really important for kids to understand as we're explaining the different areas of life that are safe and unsafe. That we are playing football in this, not really. We're playing football, we're playing baseball, we're playing tennis, right? And those are the boundaries and the rules of that game. And it's not going to make sense or it's not going to be safe if Marshawn Lynch or somebody is chucking a football at Andre Agassi's head in a tennis court, right? It's just not going to be safe. So I don't like the concept of don't cross the boundary or negative things are going to happen. It's really how do we keep this safe and make sure that we're all on the same playing field? Taking precautions. It is okay for you to ask your social worker as much as you can about Susie or Johnny before they come into your home. How many placements has this child had? How do they do with new people in their life? Do they tend to be overly friendly? It is okay for you to ask that. Your social worker may not know. The chippers tend to not have a lot of good information on it. Sometimes, we're just trying to get a kiddo placed quickly and safely, and there may not be time to ask that question ahead of time, but it is okay to ask when it's safe and healthy to do so. That gives you a better idea of how you need to approach a kiddo that maybe hasn't had that particular trauma. Practicing stranger danger, right? So put yourself in a situation where, oh, remember, we're not going to talk to the mailman about that. And that's okay to be able to have kind of those strategic moments where we get to say no or to hold back, and you can model that for someone. Carrying a current photo of your child that is in your placement, I think is really important. It's not always a first thought as a kiddo enters in your home, but if they were to get lost in a crowd, share too much information, God forbid, be taken, you want to make sure that you have a picture of them quickly available. If it is safe and healthy for you to do so, and I will acknowledge that it not always is, but if it is, making sure that your child has a picture of you, and specifically elementary school kiddos, where you can have a picture of you, their social worker, and somebody else laminated in their backpack. These are your safe people. These are the people that are allowed to pick you up. And again, it may not be safe to do so if we've got a kiddo who is so overly friendly that they're now passing your name and phone number around. We don't want to have that happen. But for our elementary school kids who have had a lot of placement changes, making sure that they know, oh, this is our short list of people they get to take care of you. And this is what they look like. And that can be good for kiddos. Updating a school counselor. The kiddo's going into a new school environment and just being able to quietly pull them aside and say, hey, Johnny or Susie is really struggling with indiscriminate friendliness. This is something that we're trying to deal with in the home. We really do want to limit the number of people that they engage with during the day. If you could help us do that, that would be important and healthy. And most school counselors are really aware and are sensitive to that need, and they can help make that happen. Even streamlining a school curriculum schedule, a class schedule, so there's not a lot of transitions. I've seen some teachers do that, and that can be helpful. If you're going to be out in public, making sure that your child is in bright color clothing. I had a kiddo in my home that I had to put him in red shoes at all times because if he would wander away without ever checking in with me, and I could find him quickly in a crowd just by looking at shoes, be able to get to him quickly. I would frequently have to memorize what did I put him in, what clothes did I put him in that morning, because he would be out wandering around. And that's right, I had him in an orange shirt, and I could go and grab him quickly. Having a matching clothing item, thinking specifically, thank you, Taylor Swift, for this, of having a friendship bracelet that both you and your child is able to wear, to be able to identify this is who my child is. They have the same bracelet on, or letting your child know, oh, remember, we're not going to talk to anybody that doesn't have the same bracelet on. And that can be quite helpful. I have a family that comes into the clinic. They're great big Disney fans, and the kiddos are always dressed in some sort of Disney paraphernalia, as are the caregivers. So it's very easy for me to identify in the hallway, oh, Susie belongs to the Smith foster family. I know that very quickly because they're in Disney gear. So that is helpful for me to be able to identify. We want to emphasize the safety and somehow avoid fear at the same time, right? One of the non-negotiables is safety in my home. Like, this is a safety issue. I have to keep you safe. That is my number one job. I can't keep you safe if you walk away from me. So if having those conversations without being fearful, right? If you walk away with me, you're going to get kidnapped. We're not going to say that. But if we can really emphasize that safety component to kiddos that have the developmental understanding that you can have those conversations, I think is important. And you are this child's biggest advocate. As you are in court hearings or FTDMs, you can say, hey, I'm really concerned about the number of placements that this kiddo has, or how many visit supervisors have been picking this child up, or the number of counselors that they've had. This is really exacerbating an underlying problem, and I would like to advocate that this move doesn't happen, or that we only have one visit supervisor. Again, it's a very broken system. I can acknowledge that, but anything that you can do to advocate for your child in that way, I think is really only going to benefit them. This one may feel odd, but I think it's really important because at the core level of those five F's, those trauma responses, fight, flight, fawn, oh, I just lost it, fight, flight, freeze, fawn, or flop, is conflict, right? I feel attacked, I feel triggered, something bad's about to happen, and I fall into one of those five F's. If we can model safe conflict, I think that's the best gift that we can give our kiddos. It is okay to disagree with somebody. It is okay to get frustrated. It's okay to get mad. And again, it's what are we doing with those emotions and how do we do it in a safe way? So if you can have respectful communication in your home in a way that this child can see it, actually, honey, I disagree with that. Can we take a minute to talk about this? Is okay for your child to be able to see that nobody got dysregulated and everyone was respectful. And what a gift for this kiddo to start seeing that they don't have to respond in a fearful way. Being solution focused, and being able to say, this is a problem and here's the solution that I'd like to discuss. Again, is where now we have a kiddo that can start thinking past a trauma and start thinking towards how to solve a problem, which is great. De-escalating with empathy. Oh, Susie, it looks like you are really frustrated right now. Is this something that I can help with? Right? I feel like maybe if there's something I can do, can you help me right now? Help you? That tends to really de-escalate because now we're giving a child control, right? Of all the things that they can't control in this world, they can control the information that they give me so I can help them calm down. And that can be a really modeled well in a home. Setting those boundaries, right? So if a kiddo can hear you say, I hear you, and I don't know how to respond right now. I need to take a break. So if you can just give me a few minutes or a day and I can figure out how to respond, that may be best. Like, I'm just going to push pause on this conflict for a minute. I'm going to come back when I know that I can be regulated. That is going to be a beautiful seed to plant in this child's life. And then taking responsibility, right? Being able to apologize not only to each other, but to a child, to be able to say, "Oh, I'm so sorry. I didn't realize that I'd hurt you. And I am sorry. What can I do to make this better?" It's going to be really important to undo some of that learned trauma response that a child has. Worth, value, and safety are never negotiable, right? We have to really plant the seed that the innate value, the innate worth of this child is worth fighting for, and their safety will always be a priority when they're in your care. So really, to sum up, we are made to be in consistent and safe relationship with each other, with the kids that are in our life. In as much as possible, make sure that we are limiting caregivers and use that FMLA or PMFL that's available to you, focusing on safe, safe, safe relationship to help undo some of those trauma triggers, being proactive as we are receiving a child in our home that may be a little on the indiscriminate side as far as their friendliness goes, and then really watching for those warning signs, especially when it comes to our teenagers and our young ladies. That can be a real problem. References for you. This will be in the slide deck. I believe Luann will send this out to you. Again, if you're not going to sleep tonight unless you can read some really interesting scientific studies. And then some extra resources for you. There's some handouts available that circles social story that I talked about, and then specific information about paid leave for the state of Washington, if that's going to help you stay home with a kiddo that needs to have you a little bit more. And then we can move to questions. I have put on my email address here for the clinic. If you do think about something at 3 a.m. and want to send an email, you are welcome to do so. I will not answer you at 3 a.m. Let me be very clear on that particular boundary. But I will get to it first thing in the morning and I can get any resources or answer any specific question to you if you think of one later.